the sort of COVID era is something that I feel like as a country we have decided to push behind us, and even those of us that were outraged by the decisions that the government made at that time, we've sort of accepted that it's such a sensitive subject, and I don't want to sort of unearth that again. What use is there in going back over it and looking at where we maybe went wrong and how we would respond in the future?
Well, the obvious answer is to not make similar mistakes in the future, and looking at the principles. And the point about deaths being more important than the economy is an important one, because at heart there's an element of truth in that. As I said, the first point should be the ethical side of things. So for example, if a government was to deliberately kill somebody or injure an innocent person, that would be wrong, however good the outcomes were. So if that was we could perhaps agree on that. But actually, the right way is to tackle that argument in terms of COVID, because when you look at any policy, it's not just a question of saving lives. Any interventional policy has an impact on people's lives, and we're actually fairly used to doing that. So, for example, a level of pollution. We know that pollution has an impact on people's health, and some people do die from pollution. We don't, as a result, say, well, our aim is to have absolutely zero pollution and nobody dying at all. Same with road accidents. We could ban cars, and we could say you can never drive your child to school, and as a result, we would reduce the number of deaths on the road.
Careful, David. They're going to get ideas if you start saying this.
Well, that's true. But you get as a principle. We actually say, okay, let's look at this. Of course, to deliberately kill an innocent person would be wrong. But a policy that results in certain people dying is not in itself wrong, because anything you do does that. If we had no pollution and we shut down all factories, we would be producing no plastics, no energy, and so on. Many people would die from poorer healthcare that we'd have, from lack of drugs that we would have in pharmaceuticals, from all sorts of areas, from poverty, because we could impoverish the country. People would be living in a really poor existence, and many people would die of starvation and so on. So of course we say, okay, well, we've got to take a rounded view. We're not saying that the economy is more important than lives. We're saying when we look at this policy, they will have certain outcomes which we are more or less sure about, and we will do our best to evaluate them within the context of there are some things that we should not do as a government. And actually, when it comes to COVID, there were fairly well established public health principles, which not everyone would agree with, but reasonably good, that when you're looking at a mandatory intervention, shutting people, lockdowns and so on, you've got to fulfill a certain number of conditions. You've got to be really sure that the benefits are going to be higher than the costs. You've got to be fairly sure that there are going to be big benefits. You've got to be sure that there's no real alternative way of doing it, for example, relying on voluntary measures and so on. And we clearly didn't apply those principles to that case. But then once you do, you've still got this case of looking at taking an overall view of costs and benefits. And this is where we have a really general lesson that had we been willing to do that, there were lots of economics. We're quite good at cost-benefit analysis, and it's not an easy area. There's lots of different ways of doing it. There were quite a number of cost-benefit analysis of lockdowns, which took different approaches, but almost without exception, concluded that even if lockdowns were going to have really high benefits, the costs they were going to have in terms of the poverty, in terms of the loss of education, in terms of loneliness, and however you measure not just economic but social costs, were going to dwarf any potential benefits, even if those benefits were high. As we know, actually, there probably weren't many benefits from lockdowns. So that work was being done, but it was ignored by government. And that's where we can have a lesson and say, well, actually, all policy choices, there are pros and benefits and costs. I mean, you need to look at them carefully, and that's the same with net zero. You have to take a step back and, from the sort of highly politicized thing of it's a climate crisis and you have no choice but to do this. That's designed to shut down debate. And the same with Brexit, where people are saying, well, Brexit's been an economic disaster. We have no choice but to get back to the EU. Well, I'm an economist, and I was in favour of Brexit, but actually it wasn't really because of the economic arguments. There were arguments on both sides. And of course, there are some costs, there are some benefits. And that's true from what's happened since Brexit. There are costs and benefits, and it's worthwhile being honest about those and going through them carefully, and then saying, well, okay, if we do decide to have the EU reset, and what are going to be the costs and benefits of those? It's not all one way, and I think that's where the lessons of COVID, net zero, we can make sure applied everywhere, just to allow debate, and actually what we shouldn't be getting away from is a free speech issue, because underlying a lot of this has been the deliberate attempts to shut down dissenting voices in all sorts of areas. And we know it extends to social policy on transgender. I've been involved in the pro-life movement for a long time, and we've experienced that for 40, 50 years. But it actually has economic consequences. When you shut down debate, you have much worse debate and you end up with much worse policy. So even if you're on the other side on the COVID debate and you felt lockdowns were perhaps worthwhile, the policies would have been, I think, improved by a more vigorous debate. The idea that we should have a consensus. So it's my teeth go on edge when I hear Andy Burnham saying, well, we should look for a consensus in dealing with care policy. And of course, that's a really big area, and it really needs looking at. But I'm not sure that's the right way of doing things, because there's lots of different approaches to that. There's implications for spending, and do we treat it as an insurance? Do we focus on a particular group? And let's thrash it out. Let's have a really vigorous argument, and not necessarily tone down. I think we should tone down the personal element where you try and shut one side up. But I'm not convinced we should tone down the level of political debate. I don't mind quite angry and impassioned political debate, as long as you can go over the top, as long as you try and base it in evidence and arguments. We should be encouraging that. So the idea that insurgent parties like the SDP or Reform or Restore or whatever it is are a sort of danger to democracy. Actually, no. The danger to democracy is this cosy consensus where you have every MP bar perhaps two voting in favour of the Climate Change Act, or voting in favour of lockdown policy, or the vast majority of MPs who didn't want us to have originally to have a referendum on Brexit, or really to implement it properly. No, let's have a really vigorous debate, including economists and all sorts of other groups of people who might have a contribution.
Yeah, here. I just want to get us back on track in terms of your three items. So I'm just conscious that, perhaps it wasn't on my bingo card of things you might say for you to say that the COVID overhang is one of the big challenges. So are you thinking about that in terms of the debt on the books, as it were, from the COVID spending, or are you thinking more of the kind of quantitative tightening that the Bank of England's still doing and kind of creating?
It's a bit of both, but the most obvious point is the debt. So we spent, £400 or £500 billion on COVID measures. Some of those you can argue, well, it's dealing with the virus itself. But if you just sort of separate out paying people not to work and paying companies to shut down, so that those two very direct things, perhaps £170 billion was spent. So that's a whole year's worth of NHS. Now, within a context of COVID, so that's one aspect. But the other aspect was, by ordering companies not to operate and people not to work, you also drastically slowed down economic growth. So that in itself had an impact on government tax take and people's wealth. So that the overhang comes in both those areas, and we saw actually, even after that, as we came out of COVID, it's hard to separate some of these things. But you had the energy crisis. Now, partly that was the Ukraine-Russia war, but that wasn't the only thing. As you came out of COVID, you had this mass demand for energy, and you had these bottlenecks because the supply chains were reopening up, and that also contributed to a big increase in energy costs, which sort of started before the Russia-Ukraine war. So actually part of the huge amount of money the government spent in lowering energy costs was linked to that as well. So all those areas, COVID has an impact, and we're still dealing with that consequence. So at a time when we still had the overhang from the 2010 crisis, we had, I think it's self-induced, but it's still there, the net zero policy crisis and the Russia-Ukraine war. The COVID policy was not just a straw on the camel's back, it was sort of several bales of hay on the camel's back that really made things worse. So had that not happened, we would be in quite a different situation. Now, I know on one point we can't change what's happened then, But I do think it's important to at least look at how we got there and how policy was made to look at how things can be improved in the future.
I think there is also the issue of people got so used to working from home that it's very difficult to get people back into offices. And I still think people are more productive when they're working collectively.
So, you have a big change. It's not all bad. You see times in meetings, there's some efficiency savings that were probably accelerated by that COVID change and the move to IT, and people are now gradually working out what works best. And of course, now we've got the AI revolution as well, which is also people will take time to settle down. So it's not necessarily the case that everything that happened during that process had net economic negative consequences. But when we look at policy, I think we identify a really big issue which we're still dealing with.
I was just thinking when you said they paid people not to work, I was thinking that's a hell of a policy, isn't it? Like, probably one of the least efficient policies you could think of.